Good evening, everyone. Thank you so much for joining the Hudson Library tonight for our virtual author event with health and technology strategist Susannah Fox. She is joining us this evening for a conversation about her new book, Rebel Health, A Field Guide to the Patient-Led Revolution in Medical Care. Before I introduce our author tonight, I want to just take a moment real quick and mention some of the in-person upcoming programs we have here at the Hudson Library. We have some exciting programs coming up. On Wednesday, February 28th, we have seats left in our simulcast room for White House Special Assistant during the Trump administration, Cassidy Hutchinson, who will be here talking about her book, Enough. On Thursday, April 4th, we have in-person actress and best-selling author Valerie Bertinelli will be here talking about her new cookbook, Indulge. And on Tuesday, May 7th, we have best-selling author Eric Larson, who will be here talking about his new book, The Demon of Unrest. So we look forward to those. You can take a look at all of the library's upcoming programs on our website at hudsonlibrary.org. You can also register for any of our programs on there as well. So I'd like to introduce our author this evening. Susannah Fox is a health and technology strategist. Her research has been featured in publications ranging from Pediatrics and the Journal of the American Medical Association to the New York Times and Harvard Business Review. She is a former Chief Technology Officer for the U.S. Department of Health and Human Services and served as the entrepreneur in residence at the Robert Wood Johnson Foundation. She directed the health portfolio at the Pew Research Center's Internet Project, where she helped create and define a new market at the intersection of health, social media, and patient engagement. She also advises organizations on how to navigate the intersection of health and technology, targeting areas of the healthcare system that need to work better for patients, survivors, and caregivers. So, Susannah, thank you so much for your time tonight. We look forward to hearing more about Rebel Health. Now, your book just came out this week on Tuesday, the 13th. So we are one of your very first speaking engagement on
You are
your
my
book.
very first audience. I am
So how lucky we are to have you with us
I'm
tonight.
so happy to be here.
Yeah,
Thank
and
you
like I
for having
said,
me.
for those of you who just came into our Zoom, I have a link in the chat. If you would like to purchase your copy of Rebel Health, we have copies available through the Learn at Owl bookshop. You can purchase your copy just by clicking on the link at any time tonight. So let's get started.
Great. I'm going to share my screen so that we can look at some slides together. What I thought I'd do is start by talking about actually the title. I want to emphasize that when I chose the title Rebel Health, it was a positive tone because people who are living on the frontiers of healthcare are building the missing infrastructure. They are weaving the net to catch everyone who falls through the cracks of the healthcare system. Another aspect of the title is it's a field guide to the patient-led revolution in medical care. And I wrote it that way because I really want people to know that when you join the revolution, and I hope that you all do join the revolution because it's a positive, optimistic revolution for change, these are the types of people that you're going to meet. And this is who you can look for. And while this is a patient-led revolution, it also is a survivor-led revolution. It's so important to honor people who have been through the fires of a treatment and survived and have so much to add to the conversation about healthcare. This is also a caregiver-led revolution. I myself have been a caregiver for elders in my family, and I think that they are just the most important members of a healthcare team. And so I want to honor the caregivers in the audience tonight. Thank you for doing the work that you do. So when I started to write this book based on 20 years of research about how people use the internet to connect to health information, how to connect to data, I found that people actually were most excited about connecting to each other. I coined the phrase peer-to-peer healthcare to capture that. And what I realized as I looked at all of my field notes, it started to emerge that there were types of people who, when they get knocked down by a health challenge, they react to it in different ways. And when they're trying to solve a certain problem, you need different types of people on your team. So I'm going to go through each one of the 4 archetypes of the patient-led revolution in turn. The first group are seekers. Seekers are people who are not getting the answers that they need. They are maybe searching still for a diagnosis, or they've been given a diagnosis, but they're confused about the treatments that are being offered to them. They just feel like they're not getting the information that they need. So they go out on the hunt for information. And they're often characterized by tenacity. They won't give up until they find what they need. The second group that I identified are networkers. Networkers are people who learn in community. They're the people online and offline who just can't help but make new friends and meet people and draw people together. They're very good at pooling resources and publicizing things that work for a group. And actually, networkers are the people that when I'm talking about peer-to-peer healthcare and I talk about the patient-led revolution, people immediately think of networkers because they say, oh, you mean like people who use Facebook groups? And I say, yes, and there's a lot more to the networker group than Facebook groups. The third group are solvers. Solvers are people who see something wrong with a medical device or an assistive device, or actually a system, and they can't help but attack that problem. They want to take it apart and put it back together again. They just have this drive to fix things. That characterizes the solvers. The fourth group are champions. Champions are people who have access to resources that are generally in mainstream healthcare that it's hard for patient-led and caregiver-led teams to access. Here we think of course, funding. We think of regulatory guidance, media attention. We also think about access to labs and manufacturing facilities. Champions look across the landscape and notice where a patient-led, survivor-led, caregiver-led team is really making headway, but they need funding. They need access to an incubator where they can grow their idea. Champions are the people who are able to accelerate and fast-track innovation. The other aspect of this book that I wanted to talk about tonight is what I call the Rebel Health Matrix. And it starts with a very simple horizontal line. There's a spectrum in healthcare, and you can think about it for your own self as I talk about it. There's a spectrum of, are your needs being met or are your needs not being met by the mainstream healthcare system? The other aspect of this matrix is the vertical line, the y-axis, and that is the problem being experienced by you or a group visible to the mainstream healthcare system? But do people acknowledge it? Do people know about it? Or is it invisible? Is it not actually being addressed in the way that you really need it to be? And I'll give some examples of how people move between quadrants and some examples of who might be in different quadrants. A lot of the field work that I've done are in communities of people living with rare genetic disorders. I got advice really early in my career to spend time in those communities because they are the artists and cowboys and hackers of healthcare who live on the frontier because they have to. And as you might imagine, especially someone who's newly diagnosed with a rare genetic disorder, they feel invisible and their needs are not being met. They may or may not have a diagnosis. They may or may not have any treatments available to them. And so they're kind of in this quadrant of despair. Now, one condition that a lot of people might think would be in the upper right quadrant, that is where it's visible and their needs are being met. A lot of people would think of diabetes. Diabetes is a very well-known condition. It's very visible. There are treatments for it. But when you really talk to people who are living with diabetes, especially people who are struggling with insulin requiring diabetes, they would actually put themselves a little lower down. They might put themselves in that needs not met and invisible quadrant. Because, for example, if someone has a child with type 1 diabetes, when they're first diagnosed, the parents and guardians need to get up in the middle of the night every 2 hours to check on that child's blood sugar. That is no way to live. That's like having a newborn for years and years and years. And so people with diabetes were very, very frustrated because people weren't really paying attention. The industry was not paying attention to their needs. So let me talk about how people can move between these quadrants and what role the different archetypes play. So here we have a challenge that's being experienced by a group. Their needs are not being met and they feel invisible. What might happen is that a group of solvers who are within that community create a solution, and only people who are part of the in-group might know about it. And so they move over to the needs met, but they're still invisible quadrant. And then networkers in the group find out about it and they start to make noise on social media. They might be able to get the attention of journalists, and maybe a champion sees this incredible solution, this innovation that's been created by a patient-led group, and they're able to give them the funding to lift that up so that everyone has access to the treatment. Diabetes is an example here where people living with diabetes who were frustrated that they didn't have access to their own data from their continuous glucose monitors. There was a dad of a kid with type 1 diabetes who hacked in to his son's continuous glucose monitor, freed the data, and sent it to his Apple Watch. He shared how he did it on Twitter. And everybody across the world started figuring out how they could do that for themselves. And they essentially forced a public conversation about this. And now there are commercially available products and devices that allow that kind of data sharing today. Another example is when a challenge is experienced by a group and networkers in the group say, this will not stand. We need to lift this up into the visible quadrant. We may not have the answers, but if we get loud and we get visible, maybe we'll attract solvers who can help us with this, or maybe we'll attract champions who have the kind of resources that we need to solve the problem. Another way that you can move pretty quickly from this quadrant of despair up to the solutions area is if seekers go out on the hunt and they actually find a solution that they and their group didn't know about. And then the networkers in the group can publicize it. So as we move to the questions, I actually had a question for all of you to think about. Where have you seen signs of the patient-led revolution in your own life or at your job? And with that, we are going to move to the Q&A portion, and I really look forward to hearing from everybody.
Well, if you would like to answer Susannah's question, you can use the Q&A found at the bottom of your screen. And like she said, looking forward to hearing some of your answers. We'll have those up here in just a moment once we get some Q&A. In the meantime, I guess I'll ask some of my questions, and I know some of my questions were already answered in your presentation. But so in the book, you shared a lot of stories about patients with long-term chronic illness like diabetes, Parkinson's disease, ALS, and even rare conditions like Mobius syndrome. What are the benefits to these? What are the benefits of a peer-led community to those suffering from chronic illness or even a short-term illness?
One of the most important messages of my book is that no one need suffer alone. There is someone or a group out there who would love to help you if only they knew how to find you. And so anyone who is newly diagnosed, whether it's something that is just cropping up or something that you're living with long term, if you are struggling, if you have questions, if you just feel alone in the struggle that you're feeling as a patient, a survivor, or a caregiver, there are people who would love to help. And that's at the very, very base of peer-to-peer healthcare and the patient-led revolution is this sense of compassion and empathy that we can find when we connect with other people.
How has social media driven the patient-led revolution?
It's been pretty fascinating to see the changes. So I'm old enough to remember when email was actually one of the one of the social medias that we used email listservs to create groups. And another really early technology was a bulletin board system. These were very much text-based ways for people to connect with each other. And what social media allowed us to do is really accelerate the sharing and also make it more sophisticated so that people are able to create videos and share photographs and pictures. But what's really cool is since I've been tracking this for, gosh, 23 years, it's the same instinct that everyone has to share what they know, connect with someone like them, and be in community. So much of this is about solving problems, but it's also about helping each other to understand our condition and knowing that there's somebody else out there who who understands what you're going through.
Mhm. Okay, well, we do have a couple comments or questions in the Q&A. Um, One of our patrons said, what names are examples of champions?
Oh, that's a great question. So when I was thinking of champions, one of the first, and I should say, by the way, that when I started writing the book, I did not have the champion archetype in mind. It's something that really emerged in my research and in the interviews that I did with the patient and caregiver innovators. They all started talking about someone who had access to funding or power, and that was the difference maker for them. For example, in the example of people who were living with long COVID, it was a journalist, Ed Yong, who worked at the Atlantic, was one of the first people who really paid attention and lifted up these stories. So it was actually media attention that was an accelerant. A journalist can be a champion. Another really wonderful example is when someone in a government agency who has access to regulatory guidance shares that insight with a patient-led group. In the example of the people with diabetes who were hacking into their own continuous glucose monitors, at first, both the device companies and the federal government, the FDA, said, hold on, wait, you guys shouldn't be hacking into your own medical devices. But then the patients were able to go, for example, to the FDA and make their case. And the FDA looked at it and said, well, actually, now that we look more closely at it, you're not trying to sell this. And so our guidance is that as long as you don't sell the devices that you are talking about, then it's not illegal. And that was a breakthrough. That was an example of how someone in the federal government can act as a champion.
Okay, the next question's a long one, so bear with me. Did you study people with ME? I hope I pronounce this correctly. Is it myalgic and
Encephalomyelitis, yes.
encephalomyelitis,
Yep.
and or chronic fatigue syndrome? Since patients with this illness, there is an incredibly strong network, community, and patient-led revolution since the needs are not being met, largely due to stigma in the medical community. Can you comment on anything you've experienced with patient communities overcoming stigma?
Great question. And yes, the ME/CFS community is one that I have admired and really just been so inspired by, because they are exactly as you say, people who unfortunately live with stigma, and yet they have persevered through just really debilitating illness and disability. It is, I like to say, there's a lot of pioneers of the patient-led revolution who, who dug these foundations by hand, that the rest of us are building on. And that's the ME/CFS community. They were the ones who, before all of us were using Zoom and meeting virtually, they were pioneers of that. And the more that we can shine a spotlight on their work, the better. So, it's a challenge to think about how we can help communities overcome stigma. I think about how, for example, Jennifer Brea, the filmmaker, was able to create her documentary of her challenges. And I think of her as someone who is a networker solver. So she's a networker in that she's always used social media to lift up the experiences of people in that community. And she's a solver in that she used her skills as a filmmaker to try and break down the system. And I would say stigma is almost like a systemic problem. And she was able to break that down by using her documentary film skills. But that's a great question. Thank you.
Annette asked, how can I find a group that finds mainstream medicine treatment for osteoporosis,
Mm.
drugs with scary side effects, unacceptable? I'm looking for an alternative solution.
It's a good question. I would say when I talk to people about looking for a patient group, you can start. One way that I would actually start is by talking to a clinician, just in case another patient has given them a recommendation, because what I found in doing the research for this book is that a lot of people who, like you, are looking for alternatives they're pro-science, but they're also pro-social. They know that they're not getting the answers that they need. They're not going to accept just the status quo, what they are being told by one clinician. They're going to go and get that second opinion. I love that you are looking for what I call the community consult. How do you find a community that could help you? So what I usually talk to people about, and this is based on the interviews that I've done, asking people, how do you find your group? They say, number one, I talk to my doctor in case they know someone that I can connect with. Another thing to talk that seekers and networkers do is listen in every conversation that you have and ask people if they know someone. You want to start that ripple effect of letting people know that you have this question. Because one of the challenges that we have in modern society is that we don't often share our vulnerabilities. We don't share that we have a question. And so the more that you tap into your community, the better. And the last thing I'll say is when you do find an online community and you start evaluating whether you're going to join them, look for one that's really active. The more active it is, the more likely people are going to be sharing resources that are useful and current, and that's really what you want to look for.
Yeah, I think that kind of is one of my questions is, as a librarian, it's my job to help people find relevant and reliable resources. How how credible or reliable is the information that's shared on these forums online?
Yeah, it's a really interesting question. So I think about the online world sort of like a river that's just constantly flowing by, and you dip your cup into the river, and at a certain moment, you join an online forum and you start reading the messages, and that's the moment that you're dipping your cup in and getting that information. Um, what you need to be careful of is that you're dipping your cup into clean water, and which is what I was talking about in terms of a healthy group is a group that has a lot of participants who are posting pretty regularly, because if misinformation, if something false or misleading is posted to that forum, if it's a healthy forum with a lot of activity, there's been studies that show a healthy group will take that material down, or they'll ask questions about that potentially misleading or false material. It's almost like it's a healthy ecosystem that when a virus comes in, the antibodies are activated in a community, and they take it down. But what is also important is that everybody needs to get their skills up in terms of fact checking, so that if you see something online, make sure that before you take the advice, you look it up. You see, where are they getting their information from? In the book, I talk about a tool that was created in the UK called the Discern tool that gives consumers the skills that they need to do the kind of fact checking that a scientist would do before they published a paper.
Um, Sue, Sue's comment, I think this is maybe answering the question that you had at the end of your PowerPoint. She said caregivers of family members who have chronic disease who develop support groups for patients and families to provide support and develop programs.
Yeah, no, exactly. It's I've had experiences in my life as a caregiver where I felt so alone when you are, it's just you alone with your loved one, and you're troubleshooting, you're trying to figure out the medications, you're tired, and the idea that there's someone else that you might be able to send a text message to or post to a forum and ask a question or just get a kind word, um, that turned out to be so important to me personally. So thanks for making that point.
Melinda had a question. She said, thanks for sharing your work. I feel strongly that we as patients should own our own medical data. The hurdles I jump through to get medical information, both personally and as a caregiver, are high, getting higher, and seem ridiculous. I'm deeply passionate about data ownership. Are there groups not necessarily linked to any particular illness to join? I want to advocate and move the needle on this collectively. Thank you.
Yes, absolutely. I love it. You're in the revolution. Um, so there's a wonderful group, and I think if you just Google it, you'll be able to find it. It's called the Light Collective. And it was started by a group of people, and the beginning of it was a group of people who live with a gene that is likely to cause breast cancer and ovarian cancer, the BRCA gene, the BRCA gene. And they were radicalized by the experience of potentially not only not having access to the data, but actually their genetic code being patented by a company. They fought against that and defeated that. But they are amazing activists in terms of data ownership. And so look up the Light Collective. And this is an issue that I think is really gaining steam because people now recognize the importance of number one, access to your own health record. That is a right. That's federal law that you have a right to that. There's another movement that I'd love to highlight, which is open notes. And this is the idea that we as patients should have a right to read the notes that are written about us so that we, for example, can make corrections in addition to having a better understanding of our own conditions. That's one to look at. But you also mentioned being a caregiver and having access. That's a real challenge. And I think that having these conversations in advance with loved ones to make sure that you are a proxy, that you're listed as the official caregiver for someone in advance of an emergency is really, really important so that you, again, have legal access to that data.
Anyone has any other questions, please feel free to put them in the Q&A. One of the fascinating aspects of the book that you shared with us are some of the anecdotes of real life seekers, networkers, solvers, and champions. What were some of the key familiar themes that you saw across your research and your interviews and case studies?
Thanks for asking that question. Again, what I had done as a researcher is spent time in all kinds of communities. And what I saw is often when people initially get a diagnosis, a lot of people just are so overwhelmed that they don't take action. But then something happens, some spark, whether it's a spark of frustration or anger, or it's a spark of hope, or they are in community with someone who shares their condition, and that person tells them, actually, there's something that could work for you. And it's that spark that was something that really characterized actually every one of the archetypes. And I think a theme that I saw across all of them is a sense of curiosity and a sense of possibility, which I think we all need to have. What my hope is to inspire people to think about what are the skills that they have, or what are the types of activities that they're naturally drawn to. You might think, as I went through the archetypes, you might think, yeah, I'm probably a solver, or I'm probably a networker. But also, you don't have to have all these skills. If you face a problem that for example, you know that you need visibility, but you're not naturally a networker, you can recruit a networker to your team. And the same thing is true. You can recruit a solver. You can recruit a seeker. Actually, one of the things that I want, one piece of advice is, if someone's newly diagnosed, they may not actually want to look at all that information. It could be upsetting to someone who's newly diagnosed to look at information about an upcoming surgery, or what is ahead of them on the path. You can ask a friend to be a seeker for you, to be your proxy, and go out into communities and find out that information.
Tamsin in our Q&A asked, do you have any estimates on what percentage of people become part of the patient revolution?
Oh, wow. I wish I did. For many years, I worked at the Pew Research Center and I did national telephone surveys that gathered this kind of data. Um, and what I can say is uh, looking nationally, when we asked people, have you gone online to look for health information? It always hovered around 60% of US adults. When we asked people, have you gone online to look for someone who shares your same health condition? It was always around between 1 in 5 and 1 in 4 American adults. I had the opportunity to repeat those questions just looking at teens and young adults, 14 to 22-year-olds. And what was very interesting is that they were just as likely as adults to go online and I mean, let's admit it, it's consulting Dr. Google. But teens and young adults were more likely to go online to find someone like them, someone who shares their same health condition or challenge. Um, uh, Girls and young women were more likely than boys to both look up health information and to look for that just in time someone like you. And actually, uh, kids who are in LGBTQIA groups were more likely. You think about how people who have questions that might be outside of the mainstream, they're very likely to go online and look for information. And that was true with adults as well as the teenagers.
Um, okay, that was the same question we answered. Okay. Um, I thought it was interesting in the book you had a timeline of peer-led health groups, and I thought it was interesting that it actually they go back to like the 19th century. It's not a new thing that we're doing when it comes to health concerns or getting access to information. Um, I think the first example you had was in 1867, the United Order of Tents, founded by two formerly enslaved women that provided health, social, and financial assistance to Black people. 1935, you have Alcoholics Anonymous was founded. 1963, Weight Watchers was founded. So these peer-led health groups, communities, aren't really a new thing. It's just, I think, the way that we're accessing each other and being able to talk to each other has changed significantly because of the internet.
Exactly right. It was, I loved researching that and finding out the history of peer-to-peer healthcare, that it makes sense that we've always, as humans, wanted to connect with each other. It's an unstoppable force that we're going to ask each other about our health. We're going to share. And what the internet has done is accelerated that process and removed all constraints of time and geography, so that everybody has the possibility of finding that person who shares exactly the information that you really need at the right moment. And that's our opportunity. Instead of it's actually kind of cool to think about that there are still so many wonderful things that happen in person. We still have Alcoholics Anonymous. We still have the idea of these in-person groups that people can really connect in recovery. And we have the opportunity to have that happen online.
And I mean, really, what's amazing about them too is they're effective and they're relatively low cost to put together, but extremely effective in supporting people through whatever journey they're in with medical reasons or whatever they're seeking their community group for.
Yeah, and one point that I'll underline there is these are groups that were not being served by mainstream healthcare. So for whatever reason, whether it was stigma, as we talked about earlier, whether they were shut out of the medical system, whether they just weren't getting what they needed, people found each other, they innovated, and what's great about looking at that history timeline is that a lot of these innovations that people came up with 100 years ago are now acknowledged and have moved into the mainstream. And so even as we see today things that look really new to us and we're like, how could that be? Well, just wait, because that new innovation might move into the mainstream if it really is serving people the way these older innovations have.
Catherine said, healthcare today is challenging. Costs are increasing. Physicians are leaving their practices. Insurance companies are stingy and put up barriers to care. Hospitals are closing and are being bought out. Any comments with these challenges when navigating medical and mental health care?
I am humbled by the challenges that we are seeing, both as individuals and systemically. I wanted to write this book because even as we see so many barriers to care, so many barriers to people getting what they need, what I saw over and over in my fieldwork were individuals who were starting the change at their kitchen table, who were saying, I'm not going to give up. I'm going to find a way through this maze, and I'm going to share the map of the maze with other people. So for me, writing this book was a way to spend time with hope, that we can't necessarily change the system. We can try. And we can have a different Zoom about that. But those are systemic and frankly political issues. Those are economic issues. And what I hope to do with this book is to talk about what we as individuals can do to create a path through this healthcare maze together.
If we have any other questions for the author, please put them in the Q&A. Let me look through mine here, see if I have anything funny, because I had many prepared, but just in our conversation and your presentation, I think we answered a lot of them.
Yeah,
Let's see. Well, I think you might have answered this, but your book is a field guide. In each chapter, you kind of highlight tips for the 4 archetypes. What do you hope your readers walk away from your book and into healthcare facilities with your field guide? What do you hope for that?
I hope that they step into their power. I hope that people see that they can be a powerful force for change in their own lives. And I hope that with these skills and with the stories that I share of other people who got knocked down and stood up and stepped into their power, I hope that more people are able to go with confidence, and ask for what they need. And if they don't get it, try again. That's really what I hope people will take. And actually, I'll flip that around and say, my hope for healthcare leaders who read my book, whether it's policymakers or executives of hospital systems or health insurance companies, what I hope is that they get inspired, number one, to be champions, to say, wow, this is incredible. How can I help these patient-led groups? And my dream is that every healthcare company or government agency has an intake valve for the kinds of innovative ideas that are being talked about in peer-to-peer health groups and among patients, survivors, and caregivers.
Well, I think our audience questions, we've gotten through all of them. If there aren't any other questions, I'll just remind you, we have a link in the chat for the Learned Owl if you'd like to purchase your copy of Rebel Health. Um, and Susannah Fox, thank you so much for your time tonight, and we appreciate
The library will be
Audience,
closing at
or
8 p.m.
evening announcements are on, sorry.
Take the final collection and come to the checkout area. Thank you.
Sorry about that. We had our evening announcements here at the library. I just want to thank you so much for your time and the research that you put into this topic. Catherine in our chat said thank you for your thoughts and hopeful attitude. And I think that's really what a lot of people that are going through health illnesses or crises or scares just need hope. And your book has certainly provided that for many people.
I'm so glad. Thank you for having me.
Yes, thank you so much. Thank you all for joining us tonight, and have a nice evening.